Did you know that malaria affects millions of people worldwide each year? Despite significant medical advancements, this mosquito-borne disease remains a major health issue in many tropical and subtropical regions. Early detection of malaria is crucial because it can lead to severe complications or even be life-threatening if left untreated. But what are the warning signs? In today's video, we'll go over the top symptoms of malaria, from the initial fever and chills to more severe signs that could indicate complications. Stick around to learn how to recognize the early symptoms and what to do if you think you've been exposed to malaria, especially if you've recently traveled to a region where the disease is common. Welcome to Ignite Health. Please do like and subscribe to my YouTube channel. 1. High fever. Have you ever experienced a sudden high fever after traveling? It could be a sign of malaria. The first and most common symptom of malaria is a high fever. Typically, the fever develops suddenly and can range from 101 degrees Fahrenheit 38.3 degrees Celsius to over 105 degrees Fahrenheit 40.6 degrees Celsius. The fever usually comes in cycles and is often accompanied by other symptoms like sweating and chills. The cyclical nature of malaria fever is due to the life cycle of the malaria parasites in your bloodstream. If you've recently traveled to a malaria endemic area and you develop a high fever, it's crucial to seek medical attention as soon as possible. 2. Chills and shivering. Do you suddenly feel freezing even in warm weather? That shivering could be more than just a cold. Chills and shivering are common symptoms of malaria that often accompany fever. These episodes of shivering can be intense, leaving you shaking uncontrollably for several minutes to hours. Malaria-related chills occur as the parasites enter your bloodstream and multiply, causing your body to react. Chills may also come and go in cycles, often appearing just before the fever spikes. 3. Sweating. Does your fever break with intense sweating? It could be malaria. After the fever and chills, patients with malaria often experience profuse sweating. This intense sweating typically occurs after the fever breaks, leading to extreme fatigue and dehydration. It's part of the malaria cycle and is a result of your body trying to cool itself down after the fever. The combination of fever, chills, and sweating can leave you feeling weak and exhausted, making it difficult to carry out daily activities. 4. Headache. Do you have a relentless headache along with your fever? It could be more than just a typical migraine. Malaria is often associated with severe headaches, which can feel similar to a migraine. The headache tends to be persistent and throbbing, making it difficult to concentrate or rest. This symptom can be particularly debilitating when combined with other malaria symptoms like fever and chills. If you're experiencing a headache along with other signs like fever or sweating after traveling, it's essential to get tested for malaria. 5. Nausea and vomiting. Feeling queasy and nauseous? Gastrointestinal symptoms are common with malaria. Nausea and vomiting are common symptoms of malaria, especially in the early stages of the infection. The parasites affect not only the bloodstream but also other parts of the body, including the digestive system. This can lead to an upset stomach, nausea, and sometimes vomiting. While these symptoms may seem similar to other illnesses like the flu or food poisoning, they should not be ignored, particularly if accompanied by other malaria symptoms. 6. Fatigue and muscle weakness, extreme tiredness. One of the hallmark signs of malaria is extreme fatigue and muscle weakness. As the parasites invade your red blood cells and multiply, your body's energy levels plummet. This can leave you feeling extremely tired, even after resting. Muscle aches and a general sense of weakness often accompany this fatigue, making it difficult to perform even basic tasks. If your energy levels have dropped significantly and you've been in a malaria-prone area, it's essential to consult a healthcare provider. 7. Anemia. Have you noticed symptoms of anemia like paleness and fatigue? Malaria might be the cause. As malaria parasites infect and destroy red blood cells, they can lead to anemia, which is a shortage of red blood cells. This condition can cause paleness, dizziness, shortness of breath, and extreme fatigue. Anemia is a common complication of malaria, especially in severe cases. If untreated, anemia can worsen and lead to other serious health issues, making it crucial to address the infection early. 8. Jaundice, yellowing of the skin and eyes. In some cases, malaria can lead to jaundice, which causes the skin and the whites of the eyes to turn yellow. This happens because the breakdown of red blood cells releases bilirubin, a yellow substance, into the bloodstream. Jaundice is a sign that the liver may be affected by the malaria infection. If you notice yellowing of your skin or eyes, especially along with other malaria symptoms, it's a sign that immediate medical attention is needed. 9. Rapid heart rate. Has your heart been racing along with your fever? This could be another sign of malaria. A rapid heart rate or tachycardia is often seen in malaria patients, particularly during fever spikes. The fever and the body's response to the infection can cause the heart to work harder to pump blood, leading to an increased pulse. If your heart is racing, especially in combination with other symptoms like fever, chills, and weakness, it's important to seek medical advice right away. 10. Breathing difficulties, shortness of breath. In more severe cases of malaria, patients may experience shortness of breath or difficulty breathing. This symptom is especially concerning as it may indicate that the infection is spreading or causing complications such as pulmonary edema, fluid buildup in the lungs. If you're having trouble breathing, it's crucial to get immediate medical help, as this can be a sign that the malaria infection is becoming life-threatening. Malaria is a serious illness, but recognizing the early symptoms can be life-saving. From high fevers and chills to nausea, anemia, and jaundice, malaria presents in various ways. If you've recently traveled to an area where malaria is common and you're experiencing any of these symptoms, don't wait. Seek medical attention as soon as possible. Thanks for watching. Make sure to like, share, and subscribe for more health tips and important medical information. If you've had any experiences with malaria or know someone who has, share your story in the comments below. We'd love to hear from you.